Good morning, everybody. I'm Councillor Mike Quigley, Chair of the committee, and would like to welcome you all to this meeting of the Adult Social Care and Public Health Select Committee, which is being broadcast live and recorded for publication. So if we move through the agenda, the minutes of the last meeting, I would ask if the committee could show their approval so that I can sign them. Everyone content? That's unanimous, thank you. I'll sign the minutes. And then could I ask the clerk if we have any apologies today?
I've not received any apologies. Councillor Barney's got his hand up.
Can I just give apologies on behalf of Councillor Dr. John Doddy, who unfortunately is attending a funeral this morning.
Thank you for that. Do any members or officers have any disposable pecuniary interest to declare? No? Any private interest to declare, pecuniary or non-pecuniary? None? That's fine. So our first main item on the agenda then is firstly to welcome Scott McKechnie to the meeting as the independent chair of the Safeguarding Adults Board, and Scott is going to introduce the annual report.
Thanks, Councillor. So yeah, as I say, I'm Scott McKechnie. I'm the new independent chair for the Nottinghamshire Safeguarding Adults Board. So this annual report covers the period up until the end of March of this year, so it's last year. And there's a short presentation on 3 slides that we're going to give, and also the supporting paper and the annual report, which was part of the papers for today. So just to remind everybody what the purpose of the Care Act and the statutory requirements upon the Safeguarding Adults Board is to produce a strategic plan, which we've created a new one this year for 3 years up until 25, and conduct safeguarding adult reviews undertaken as part of that system, and then produce an annual report, which you've got as an appendix today. The main adult strategy continues on the 3 themes of engagement, insurance and prevention moving forward into the years ahead and up until now. So if we move into the next slide, please. So what you'll see here, which is also part of the annual report, is just an update on some of the systems, and I'll provide some of the some narrative around some of that as well. It's important to remember at the start of this annual report period that we're still within the pandemic. So the Safeguarding Adults Board was operating from a interim strategy which was focused on the pandemic response to and recovery from the pandemic. So it was very different. But when you start to look at some of the data which is shown on that report, and an annual report is a 46% increase in referrals, safeguarding referrals into the system, which is a significant increase in workload into a system, which I would say is probably a little bit under strain at times at the moment, the safeguarding system. What that shows is abuse in the home and care homes continues to be the number one, with neglect, which has consistently been the highest referral type into the system as it is a safeguarding adult system. So one of the things that the board works on in particular is the partnership assurance tool, which you get from the main statutory partners, police, health and social care, adult social care, and how they have contributed to the priorities of the board, and in particular those board priorities. And we look at that quality assurance approach through some of the subgroups around learning and improvement, the SAR subgroup, which is safeguarding adult reviews, and also the quality assurance to drive the business of the board and seek assurance, which is done. So as I say, this was done during the period that was still within the pandemic, so there's still a lot of work going on with the Local Resilience Forum around a recovery from that. We did do a review with Healthwatch. They were commissioned to do some review into some adults with lived experience, and some of the learning that's come from that. So the areas of improvement have been around the timeliness of interventions, and some training around that has been delivered, and also given the staff that how we can manage expectations of those safeguarding referrals, and more detail around how we provide updates in a timely manner into the adults and also families and carers of those individuals. So that resulted in some of the co-production of some of the complaints material across the system. And if we move on, and one other key bit of work that's ongoing just now is there's some evolution in the working practices of the MASH, the Multi-Agency Safeguarding Hub, which the partnership has been, or the board has been providing some regular updates through the partnership board, but also some sort of assurance and accountability around how those changes are being embedded across the system. If we move on to the final slide, so to start to give you a bit of an update for me, appreciate there'll be questions after this around what the plans are for the next 6 months. Obviously, one of the key things as a new chair coming in is to develop those positive working relationships across the board with the key statutory partners. But one key piece of work which will not miss any of the people in this room is that the enactment of the integrated care partnership board system strategy that's coming towards the end of this year. So that relationship is a key one that I will continue to make sure the board has with the ICB and the ICP, where some of you may sit on the ICP. So I've already met with the Chief Operating Officer, their independent chair, just to make sure that wherever possible for the safeguarding system, because it is a system, we try and make sure that the work is aligned and working as close as we possibly can together. One piece of work which has already started, and I'm sure, so Edenfield Mental Health Trust, which was a panorama show so we've started a piece of assurance work within Nottinghamshire to look at wherever possible, as far as it possibly can, in these sort of closed culture environments, that isn't happening in Nottinghamshire just now. So early assurance is positive around that, but actually it's building in what more can we do. And this is a piece of work that's getting led by the Integrated Care Board, supported by us as the Adults Board, to look at, in particular, what assurance, what systems in place, because there are a lot of adults who are placed into homes in Nottinghamshire from outside of this local authority area. So how we'll be seeking assurance about all those individuals that are placed in homes. The board itself, in year one of the strategy, did a sort of review of the board structure. So now, as a new chair coming in, I'll be looking at the governance arrangements, the subgroups, and how we take forward the priorities of the board into this coming next couple of years. And those key areas are support for carers, domestic abuse, including coercive control and behaviour, social isolation and neglect, rough sleeping, and one that we'll be working with the Children's Partnership around is around transitional safeguarding from children to adults. And we're aware of the potential CQC inspection of adult social care, which can take place any time after April of this year. So again, I'll also be providing some critical offence status to adult social care and those inspections with the experience I've had in the past. But also there's another key piece of legislation that's coming in to play in this coming year that the board and adult social care in particular will support, is the Liberty Protection Safeguards, which is the change to the deprivation of liberty standards, which is coming into place in April of 2024 and has quite a significant impact on children's social care. It's an adult safeguarding tool which is now developed, crossing over into children as well. And you'll all be aware of, obviously, the independent inquiry into child sexual abuse, and any recommendations that are coming from that, as a board, will make sure that they are being implemented with partners. And that was the main things I think I had to cover off as part of that annual report. But
Thank you, Scott. Councillor Barney, have you anything to add to the item?
Yeah, I just would like to say it's the first time actually that I've had the pleasure of meeting Scott in person, but I've been on a couple of calls with him today. And obviously it's an incredibly important role he's taking on with safeguarding of adults, and one that this committee is clearly very keen to be kept abreast of. But I thought it'd be worth Scott you just taking a couple of moments just to share your background, because Scott and I were both very impressed with the credibility that you bring to this role, and I think the committee would also find that interesting.
Yeah, so I finished policing in June of this year. Was what was Detective Chief Superintendent, so head of crime, which was all criminal investigations across Hampshire and Isle of Wight. When I finished my role, so I had a large portfolio that managed all investigations, criminal justice, custody, scientific services in Hampshire. But prior to that, I'd previously held roles as head of child abuse, head of public protection, but also led a number of sensitive inquiries into child sexual exploitation and other sort of high-profile inquiries involving children and adults. So I've sat on children's partnerships and adults boards for a number of years, and also I'm the independent chair and scrutineer for Hampshire, Isle of Wight, Portsmouth and Southampton children's safeguarding children's partnerships. So I have a broad spectrum of roles that I do there. So what I bring with that is somebody who has been working in this system for a number of years, understands the business, but at the same time I'll be able to ask the questions that are required on behalf of, as somebody who's independent, on behalf of adults, families with lived experience, and I'll make no apologies at times. I'll be asking questions that I'll probably not know the answer to, but that's part of what I will bring to the role, hopefully.
Thank you for that. Obviously, this is a report on historical data from the previous year, and a lot of it happened or went before you became chair. So I would ask that members be kind and not too not too confrontational in terms of Scott's involvement in this. But I think what personally I'd be more interested in is seeing what the key drivers are for next year in terms of priorities and issues that are likely to raise their head. And maybe if it does work, that instead of waiting a whole 12 months before we have an update, is that if we could look at it again in 6 months' time to see how progress is going on those key issues. Councillor Barney, I don't know how you anything to add to that suggestion or disagree with it in any way?
No, be guided by your request. I think the more transparent. We obviously don't want to stagnate your agenda in any way, Chairman. But obviously this is very important. So if Scott's obliged, I am.
Thanks for that. I open it up now. If anybody has any issues or questions, Steve.
Thank you. Welcome. You've actually taken over role. It's not easy, but you've got a very professional team of people in Nottinghamshire that deal with this sort of thing, and we've got a good record on it. One thing that is worrying me is the experience that we're having locally, although not in Nottinghamshire, next door in Erewash, with the arrival of many refugees seeking asylum who have been put in 2 hotels in the Sandy Acre area. Many of them arrived in very poor health, and the local authorities received next to no notification from the Home Office that they were even coming. I'm not aware of any, because they've mixed adults and children together in these hotels, which is not good. But I am aware nationally that getting on for about 200 children have disappeared from the system. I'm not certain whether we've got any hotels like this yet in Nottinghamshire, but we're likely to get them. Could you advise me what we're putting in place to ensure that these people also come under our safeguarding regime?
I'll probably pass that on to say I'm aware. I was in Mansfield last month during Safeguarding Adults when I spoke to Chief Executive there, and there was a hotel in Mansfield that had happened at. But in terms of response, it's probably better coming from. So.
Yeah, so there is a corporate piece of work, obviously, working with refugees, and our social care senior managers are linked into that. So we have got that contact, that link, and would pick people up through that process.
Thanks, Chair, for bringing me in. In relation to the report before us, obviously it's a very important topic in relation to making sure that we put systems and work with partners to ensure that adults are protected. It's right that in our notes we highlight the abuse at Edenfield because when you look into the situation at that place, it's an absolute travesty that the abuse and the neglect went on for so long. And this is not a new thing because obviously we can all cast our minds back to the situation at Winterbourne View. In relation, that was 10 years ago, and it doesn't seem to me that things have really improved that much. And we've got a history and a list of institutions such as Staffordshire Hospital, which were even further back where there was institutionalised abuse. And I think it's right that we highlight those poor indicators of service to people. So I'm very clear that working with Scott and the group that we look at in making sure that these sort of things don't happen. I'm quite confident that when we look into things it will. But in relation to the appendices in the yellow pages of the report, can you let us know, let the committee know, is there a backlog of reviews for safeguarding in adult social care? And if there is, could you indicate to us how those are being looked into? That's first question. The second one, in relation to the snapshot, the map, and the pie chart and the figures, and it says at the bottom, 96% of people involved in Section 42 inquiries. Section 42 inquiries, if members don't know, is where under the Care Act we have a duty to look into and inquire about issues, but it don't mean to say that we or you have to do it. You can pass that on to others. Are there any instances where we've passed that sort of investigation on to others, and who are the others? Are they our partners in relation to the people that are actually involved? That's the second one. And in relation to the pie chart, when I did CSE maths, well, it used to call it arithmetic in those days, pie charts usually added up to 100%, and that only adds up to 59. So we're up to the other 41%. Anyway, wish you well in your future enrolment, and well, I hope to be working with you. Thanks very much.
So in relation, so we've got two safeguard adult reviews underway just now. So they've been commissioned by the board and they are underway. So they are allocated to authors. Is that what you refer to? Are you talking about the Section 42s into the MASH? No. So they both have authors, and that process is underway, and that's managed through the Safeguard and Adult Review subgroup of the board. So that they are both underway at the moment, and they will be subject to obviously that audit review, and any learning that may come from that will be taken forward. In relation to your second question, I think Sue might be best to answer that one. And then the maths, I apologise.
Sorry, what was the second one again?
Adult social care. Do we have a backlog?
Do you mean general reviews as opposed to we are on track at the moment for year end to have just completed 70% of our normal reviews, so that's just anybody who's getting a service from us, and we do prioritise those for people where we think there might be issues, or they live alone, or they're living alone with carers, and we are seeing what we can do to get that number higher, but we do have pressures across all our services, so everything that we've got is being prioritised at the moment in terms of risks to individuals.
In relation to the section 42s, obviously it says in the act that we have to start off an investigation, or we can ask another to do so. So, do we ask others to do so? Is that's the thing, or do we do them all?
We do ask others to do, and obviously we're working with a lot of colleagues, the police, fire and safety, health. One of the pieces of the priority work for next year is to work more closely with our partners, because we think there's more that could be picked up and resolved without it needing to necessarily come for a full safeguarding investigation. And you can see that in the figures where we're getting increasingly higher number of referrals. But quite a proportion of those don't actually go on to need a full safeguarding. So we think we can improve things for people, get things resolved earlier, and there's a whole programme of work behind that.
And I'll just support that. I went to the MASH in the first couple of months here and seen some of that progress that's been made, and it's very, very positive. And like any referral, Section 42, or even a child safeguarding referral, same ways, it's quite often that, if police make a referral, doesn't mean to say the police will continue that through. It will be discussed at the multi-agency safeguarding hub.
Councillor Pringle.
Thank you, Chairman. Scott, welcome, and thank you for taking the position on. I think we all recognise the suspicion that's a position which is results-based, and invariably the negative side tends to overpower any positives that come out of it. First, I'm going to talk about presenting figures as been presented, such as on the pie chart, which Paul's pointed out. If we want to start off with whole numbers, then stick with whole numbers. Don't give us whole numbers and change it to percentages to try it. It seems as if something's been obscured. Okay, it's quite simple. Just give us the same numbers, and you can refer them both to the 9758 on my papers. I know yours is different, but 9758 is 100% mark, and then change everything to suit. That just makes common sense to me. It just makes it open and transparent. So that's something I'd like to see moving forward in the reports if they're going to come up every 6 months. And then in your section where you present to us, you recognise that the system is under strain. What are the strains that you're seeing now, and how do we think that we'll be able to apply them? Thank you.
Yeah, because I think the system, the social care review, obviously the government are doing that both across the adults world and the children's world. You do see a system that's under strain, and I do see that from elsewhere as well. And the East Midlands network of chairs, we got together on Friday, and everybody talks about the same issues, and that is probably the biggest thing, is about that recruitment, retention of staff. And the gaps, I think it's 130,000 gaps across the system in England. Don't quote me on that figure because that might not be 100% correct, but that was what I got at a conference recently. So that does have an impact on the response to and the ability to react to the safeguarding concerns that's coming in. And that does have an impact on staffing levels across, from care homes to social work staff to occupational therapists and the like. So Sue will probably be able to give you an accurate snapshot around what that looks like here and now in Nottinghamshire. But that is something that I see. I don't just see it here; I see it elsewhere, and it won't be missed by that care review is now in balance as to which way it goes forward for adults in particular.
I want to come back if I can.
You want to come back? Did you?
If I can, yeah. So we recognise that it's a national issue with regards to care and retention. Has there been any thought into asking the army to come in to support in any way at all?
When we were in COVID and the local resilience forum was established, and it was very much in emergency conditions, then we did have the army come in support us and everybody. So if things get to that critical state, there are all that governance and emergency planning can be instigated. However, whilst it's very stretched, we're not in that position at the moment. So in terms of the wider care market, there's a report later on today for your information that shows how we've used the funding, etc., and to help that market. And the market is stabilised. we would still like to see more capacity coming through, but actually Nottinghamshire's doing fairly well, so it's very stretched. But we aren't seeing the number of market provider failures. We were having a lot of providers handing people back to us because they didn't have the staff to work with them last year. Fingers crossed so far this Christmas. We are in a better position. And then, as Scott mentioned, it's the whole workforce, but we have got a comprehensive workforce strategy that's operating on many levels. And in terms of our own staff, in adult social care, we've actually filled all our unqualified social work positions following a big recruitment drive, so that's really positive. We've got a grow your own apprenticeship scheme where we're putting lots of people that work for us already through the option of qualifying as a social worker or occupational therapist. So it is really stretched. We're also looking at any jobs, any tasks that qualified workers might not need to do that are more administrative, and we've set up a specific team to help them with that so that more of their time is free to work with people. So those are just a few of the things that we're doing. The teams are very stretched, they're very tired, as are their health colleagues. But they're doing a great job. But unfortunately, we are losing a lot of older, more experienced staff who are retiring and leaving the service. It's a well-known story nationally.
Thank you, Sue. Councillor Owen.
Yes, thank you, Chairman. We are, of course, a scrutiny committee, and I was wondering, and I appreciate you've not been in post for very long, but I was wondering if there was any issue, any topic you felt that this committee could scrutinise to try and improve service provision, or to look at what might be going wrong in any certain areas.
And I appreciate that support actually, but it's probably one that I'd have to talk to the board about. I haven't chaired the board, but I will take that to the next board and say that would very well come offer from the scrutiny committee for any piece of work that we can take forward to yourselves. Thank you.
Thank you, Councillor Carey.
Thank you, Chairman. Referring to page 8 of the pack, 74, the second section in there about MASH, etc. The third bullet point says that you've set new targets for the percentage of adults where risk was reduced or removed following the safeguarding concerns. In terms of looking at the importance of those numbers, do you look at the obviously there are sometimes some very, very complex cases where actually sometimes the outcomes of those cases may appear to be positive, but there's stuff going on in the background that people may not be aware of, and abuse can continue where we think it's not, where we think it's been reduced. So do you look at that to ensure that the way that you monitor the performance and in those cases are reviewed, and that you've got organisational learning or outcome learning to help that process, please?
Yeah, so that in particular, that area is part of as an evolution group within adult social care, but also through our quality assurance subgroup. They will look at the data and any outliers in particular. As you say, you can't always close off all those opportunities for abuse, but wherever possible, and some of the changes that are taking place in social care, in particular the MASH, are trying to focus the services on those cases which need the most sort of specialist provision or expertise to manage those safeguarding adults risks.
Councillor Fielding.
Thank you, Chair. There was a 46% increase in the number of concerns received in the past year. What do we think is the underlying reasons for such a significant increase?
I'm not sure I can answer that question, because quite often I may have to pass on to Sue to give some knowledge around that before my time here. But that was during obviously the period of the pandemic as well. During that, and one of the key things around that data is that safeguarding referrals are made, but are they getting made also for the right cases that require a response under Section 42 of the Care Act, which is a key thing and a key piece of work that over coming years that we need to try and get right. So if agencies are referring in, is it for the right reasons, for the right provision to take forward that, or is it stuff that's coming in that maybe doesn't elicit a Section 42 care response, and that's what's discussed in the MASH. I don't know if there's anything else you want to come in there.
Yeah, I mean, COVID had a real impact, didn't it? So we did see during that time, unsurprisingly, a lot of people were living alone, were much more isolated, or families were living alone and sharing houses, so and not seeing other people. So the key areas that we did see increases was people who lived on their own, self-neglect. A lot of those. We also saw a rise in physical domestic violence as well in the home, and then some of the impact on providers as staffing were off and well and they were struggling to cover services. There was some referrals coming through there as well about the quality of services. So those were three of the areas that, not unsurprisingly, I think during COVID there was an increase, and we're seeing that reducing now.
Thank you. Anyone else before we? Councillor Henshaw, you indicating you want to speak again?
Very much. Looking at the Nottingham Safeguarding Adults Board plans for the next 6-12 months, and I highlighted the issue of Edenfield and subsequent problems that we had. Would perhaps Sue might be able to? Would this meet the criteria for a safeguarding adults review? Because obviously we're looking at assurances from the Integrated Care Board, other agencies, to make sure that a similar situation to that terrible abuse doesn't happen in Nottinghamshire. And if you look at the criteria for a safeguarding adult review, although there were 2 in the last 2021 to 2022, and it's quite clear in the writing about how safeguarding adult reviews are undertaken, that it's an exercise in learning, not in blaming. So therefore, by incorporating a review, we're learning to make sure that those sorts of abuse and issues relating to poor care do not arise again. So I'd just be interested to know whether or not the assurances that you're looking for about these close cultures, how you're going to drill into that to make sure, because they can make assurances, but at the end of the day, nothing changes. And, we're quite clear that we don't want a situation like Edenfield or Winterbourne View to happen in Nottinghamshire. Thanks, Chair.
So in terms of the adult review, it won't be a piece of quality assurance work that comes through the board and also the Integrated Care Board as well, because it's been led by Health supported by us. But I do agree with you. You mentioned Winterbourne and Novus, and the National Children's Panel just published a report around some children's homes in Doncaster, same situation. So it is the nature of closed cultures, but one of the pieces that I went to attended the first meeting, I was really keen to make sure that we had the right systems in place to react to any concerns, particularly whistleblowers, because that's where you want the information to go out. You want whistleblowers and us to react in a sort of definitive way when you get that report, working with CQC and other partners to make sure that the right response is put in place for any concerns that are coming through, and make sure that whatever we do now in Nottinghamshire is a more sustainable approach to any concerns that are coming through of that nature, because the response requires to be robust enough that we would seek assurance of the board, but also the Integrated Care Board, that this isn't happening in Nottinghamshire, and we would find out if it was. A lot of it comes down to leadership and culture of the workforce and in the locations where it's taking place, and we just need to make sure that we have those regular touch points and those reviews that are taking place with adults in those homes, that when they go in to do those reviews are looking holistically at the culture of that location, not just that one adult who's there.
Thank you. Councillor Pringle, did you want to?
Thank you. Quick one, Chair. Sorry. As we've agreed for the 6-month return, can I ask that we have the previous annual figures as well as a comparison to this and to what we presented today? the annual figures previously, and then have a look at the 6 month one just so we can see how we're gauging things.
Thanks for that. Is that possible? Councillor Henshaw.
Thank you. I mean, it's quite right that, you know, I support Councillor Owen said about us being a scrutiny committee, and perhaps there are issues in this document and in the report that. Bearing in mind, we do not want a situation like Edenfield to happen in Nottinghamshire, and things are in place to try and alleviate it to make sure it doesn't happen. But perhaps that's that particular issue, how that investigation's been undertaken, what response we have from the Integrated Care Board, what issues are being put forward to make sure that there aren't close cultures, and then as a scrutiny committee, once that's reported, let us look at it, because none of us in this room wants a situation like Edenfield or Winterbourne View or anywhere else to happen in Nottinghamshire. So I support Councillor Owen in that, you know, perhaps these are some things we need to drill down on the work programme. Thank you, Chair.
Thanks for that. Anyone else before we conclude? No? In that case, we do have one recommendation in the initial report, but through the course of our discussions, we have suggested further recommendations that we add to the one in the report. So if I could ask the scrutiny officer to read out the notes that we've made, and then
Thank you very much. So it's just two further ones. So firstly, the committee would like to note the annual report. The second recommendation is that the independent chair of the Nottinghamshire Safeguarding Adult Board attends the June 2023 meeting of the Adult Social Care and Public Health Committee to present a report on the current activities of the board and the progress being made on its strategic priorities. And then finally, that future reports to the committee show statistics using whole numbers rather than percentages.
is there any other recommendation we want to add? Are we happy? Are we content? Can we approve those then? It's unanimous, thank you. Can I just thank Scott for his attendance today? And I know you've got other things to do, so you're welcome to stay if you want, but I'm sure you've got things that you need to be doing, so thank you for your attendance. Right, members, and if we move on then to agenda item 5, which is the improving health outcomes of people in Nottinghamshire. And I believe Jonathan's going to present us a short slide presentation before we discuss.
Thank you, Chair, and good morning, councillors. Yes, I'll be pleased to do that. In discussing this item with Councillor Quigley several weeks ago now, we identified that whereas there may be members of the committee already who are perhaps have in mind some things which they'd like to focus on in future sessions, that it would be of benefit for this initial presentation, which is the first time that public health item is coming to select committee, that provide a bit of an overview of the health of the population in Nottinghamshire and a bit of a frame of reference within which you might wish to then consider where you apply further scrutiny. So that's what I'm going to do, and I've got half a dozen slides or so that I'd like to take you through. If I just get those up on the screen. And okay, so yes, we're going to be looking then at improving health in Nottinghamshire, and to give you a feel for where we're going with this, I'm going to cover off the following points broadly, which are intended to give you something of the big picture. I'm then going to helicopter down into some of the detail for a moment or two, and then we'll come back up to a higher level at the end of the presentation. But to start with, let me then just frame this in terms of the statutory duty of the council, which is that we have a duty to take steps to improve the health of the population. Sitting alongside that, we should keep in mind the government's strategic goal, which has been in place for over a decade now, which is about improving healthy life expectancy, and I'll show you what I mean by that in a moment, and reducing inequalities in health. So that's the really the strategic framework within which we're working. In a moment or two, I'm going to say something more about the building blocks by which this is achieved, and what happens when those building blocks are weak or missing. The bit where we're going to dive into some detail for just a moment or two is about how we go about measuring health in Nottinghamshire. And then we'll come back out to a slightly higher level again in terms of some of the steps we're taking around that. So if we think for a moment or two about the building blocks for improving health, and those are set out in paragraphs, I think, 9 and 10 of your report. Some of you will be very familiar with this already, and with a graphic which is summarised up in the top left-hand corner there. And that's really making the point that if we're talking about improving the health of the population, the really important things to have in place are to make sure that every child gets the best start in life, that we've got really strong arrangements across all of our communities around education, that things like housing and employment are reliable and secure for everyone in Nottinghamshire, and that that employment, that the work people have is good work and of a reasonable level of security, that the food environment is one where people are able to access a good diet which is affordable to them, and where they have the capacity to make use of that themselves within their households, that transport and air quality and the wider environment promotes health, and that the community networks around us are strong and healthy, because it's these things which actually go to creating the conditions for the good health of the population. And there's plenty of evidence out there, nationally and internationally, to indicate that rather than focusing in on the consumption of healthcare, that it's these things that we first of all need to attend to, and to a very large extent shape the health of our population. So I'm going to be, you'll hear me from time to time coming back to this theme about the building blocks for improving health, the building blocks for good health and well-being in the population. This chart, which is almost invisible to you from a distance, but I'm going to draw out the main features of it, will, I think, come back to this the strategic goal, which is around improving people's healthy life expectancy. If we focus up on the left-hand corner, where we've got an arrow there that indicates the total length of life for females in Nottinghamshire, you can see a red part of it and then a grey part of it. The two together represent the life expectancy at the moment of a female born into Nottinghamshire in this year. They can expect to live a total of something like 82.5 years based on the experience of females in Nottinghamshire currently. The red part of that represents, on average, how long a female can expect to live in enjoying good health. And you can see that, on average, a female in Nottinghamshire would enjoy good health for about 61.5 years. And then the remaining years of her life in something less than good health. And you can see the same numbers for males underneath. The link back to the building blocks for good health and well-being is that when those building blocks are in place, the red part of that line increases, and it shrinks in overall terms the amount of life spent in poor health. Of course, it also goes some way also to extending overall life expectancy, but in particular, those building blocks make sure that people enjoy good health and well-being for as long as possible. Where we find those building blocks missing in any way, then we find big variations in life expectancy overall and also in healthy life expectancy. And the data we've got here on towards the right-hand side of the screen draws that out. And that if you compare our least and most advantaged communities, there's a gap in life expectancy of something like 7.5 years. But very starkly, when you look at healthy life expectancy, there's a gap of something like 19 years gap for women when you compare women in our least and most advantaged communities. And of course, that represents an enormous burden, not only for those individual women and their families and household, but also for those communities, when you consider that those people are losing their good health well short of the statutory retirement age. So that creates all sorts of pressures and burdens for those communities. So these are making points then about the building blocks for good health and well-being. I'm going to take you now into just a little bit of detail. I hope you'll bear with me, and I'm hoping that that my arithmetic and some of the numbers will bear up to scrutiny in due course. It's important that we're able then to measure health and well-being in Nottinghamshire. We have available to us in England something called the Public Health Outcomes Framework that a number of you, I think, will have seen before. The Public Health Outcomes Framework, or the FOF, as some refer to it as, represents about 200 different indicators of information about health and well-being, or about the risk factors or the conditions which go to creating good health and well-being. And it provides that information for every upper tier local authority right across England. So it gives us an opportunity to make comparisons between Nottinghamshire and other local authorities. Those 200 indicators have been chosen with that government strategy in mind, that strategy of increasing healthy life expectancy and reducing the inequalities and the variations that we see between different communities. Most indicators show that Nottinghamshire fares as well as or better than England average. So by and large, looking at county level, Nottinghamshire fares similarly or better than England average. But of course, we do know that if you're only looking at county level, that masks some of the variations at a local level, and that particularly brings out where some of those building blocks may be missing. The majority of those indicators are not things that are solely within the gift of the county council to tackle. Most of them require effective partnership working with other statutory agencies and indeed others, voluntary sector, third sector, private sector, and beyond. You will see in your papers some further information about the Public Health Outcomes Framework. One of your appendices summarises all 200 of those indicators, and you'll find 2 or 3 pages at the start of that appendices which summarises those where Nottinghamshire fares better than average, then moves on to 2 or 3 pages where Nottinghamshire performs similarly to England average, and then at the back there's a page or 2 where Nottinghamshire is shown to perform less well than England average. Broadly, the actions required to address those areas, indeed to sustain the performance of Nottinghamshire where we're doing well, but also to address areas where we're not performing as well as England average, are incorporated within the council's own Nottinghamshire plan, and also within the joint health and wellbeing strategy for Nottinghamshire. And I've summarised for you there the 4 main ambitions, priorities within the joint health and wellbeing strategy, which you'll see reflects the need to give children and young people the very best chance in life, the best start, reflects the need to create healthy and sustainable places, and that very strongly brings out the point about building blocks for good health, because that's about making sure that the environments in which we grow, live, work, and age are really health promoting. The third one, though, bringing out the importance, nevertheless, of the provision of really effective services across all our communities, so that everyone who wants to exercise some more control over their own health receives the right support to do that. And then the fourth one, which is badged up here as keeping our communities safe and healthy, but if you were able to read the small print, is particularly focused on providing support to people in our communities who find themselves most marginalised. So it's particularly focusing in on inequalities. So it's those four broad priorities which are incorporated within the joint health and wellbeing strategy, and against which you'd expect to find action plans to address some of the things that are brought out where Nottinghamshire performs less well than England average. The final slide I wanted to bring you represents what I'm afraid was slightly late news in terms of the writing of the report. At the very back of your appendices, you will find some information that the Office of National Statistics have just very recently published, which takes you from some slightly mind-boggling detail back up to something rather higher level in terms of being able to summarise how does Nottinghamshire, and indeed the districts and boroughs within Nottinghamshire, fare in terms of outcomes, but also the risk factors for individuals in terms of the health promoting behaviours, and then thirdly, coming back to those building blocks, the environments, the conditions for promoting good health and well-being. So you will find at the very back that information from the Office of National Statistics, and what they essentially have done is to take some of those indicators from the Public Health Outcomes Framework. I feel like they have blended them together to produce a simple index. And what I'm showing here on this last slide to present to you is the summary indicator. Now, the index is constructed in such a way that back in 2015, taking England as an average, the index for good health was 100. And anything subsequent to that, which is more than 100, represents an improvement on health, or something less than that represents a reduction in health. And you might just be able to discern over on the left-hand side next to England, there you've got Nottinghamshire displayed, and you would find, in common with most other areas of the country, that Nottinghamshire has been fairly flat, or if anything, slightly heading downward, reflecting some of the early experience, the early parts of the of pandemic. But importantly, over on the right-hand side, it'll be no surprise to you to see that Rushcliffe enjoys, compared to England and compared to Nottinghamshire, very good health and well-being as a population, and that has held fairly steady. And that is in some fairly marked contrast to other areas of the county, where the bars are below the 100 line. So their experience of outcomes is less favourable than England average, and in some cases you can see has also declined slightly over recent years, or held roughly the same. So this provides us, doesn't it, the really the context within which we need to focus back on those building blocks and making sure that we've got the right things in place. And of course, in terms of the scrutiny that you bring, that the county council in particular is playing its part in that. Chair, that was as much as I was going to share now, but happy to take questions on that, of course.
Thank you, Jonathan. Open it up then.
Do you want me to leave it up, did you say, or take it?
I would say I open it up to the floor now if anybody wants to ask any questions. Or
Thank you, Chair. On page 38, we've got 7 of the female indicators that are worsening. Why do we think that, as I say, that should be so? And the other thing that does, when we're defining communities and demographics of districts or boroughs, do we take into account where new build is happening? Because certainly within the division I represent, there is significant new build, and in some parts of that we've got high indices of deprivation there in the past. What I'm concerned of is that the new build will mask deprivation that exists, and that the numbers will stack up in a way that you know, an existing deprivation system will not show because of the new build.
Thank you, Councillor. So 2 questions there. First of all, in regard to the data on page 38, where you quite properly highlight that there are several indicators, well, there's almost 2 pages and a half of indicators there, where Nottinghamshire is worse than England. In the context of overall Nottinghamshire faring similarly or better than average, and broadly the reasons why, I would answer it at the top level by coming back to the point around building blocks. If we're thinking about life expectancy and healthy life expectancy, we need to make sure that we've got all of those right conditions in place so that people grow, live, work and age in environments which are health promoting. Where those are in place, we find that we have really healthy communities and healthy populations. Where those building blocks are weak or missing, that's where we fare less well. So where we find that there are indicators around healthy life expectancy for women, for example, which are worse than average, that's reflecting those weak or missing building blocks. There are some other indicators in here, which, if you like, the healthy life expectancy is a very kind of overarching indicator. There are other indicators that focus down on a little bit more detail. So I think let's check down the list there. I think you were looking at ones around women in particular. The one that I was imagining might grab some people's attention because it's been a long-standing challenge for us is around smoking status at the time of delivery. Now that is, which is enormously important, both to those women and also to their newborns. And that is something over which the County Council has some influence, to the extent that we work very closely with our NHS colleagues to make sure that there's a really strong offer of stop smoking support to women who are on the maternity pathway. So there's a lot of work going on at the moment around Sherwood Forest Hospital in particular. So that's just an example of one of the indicators sitting beneath that overarching kind of healthy life expectancy where we're giving some attention at the moment, but where we rely on our NHS partners as well. Your second question is about what do we mean by communities, and to what extent would the indicators for a community, which perhaps might be relatively disadvantaged at the moment, become masked over time, I think, by some new builds where perhaps people come in who enjoy better health. Well, you're quite right to highlight that. That in that instance, that would happen. So over time, over a number of years, if you had a lot of people coming in to an area who enjoyed much better health, then that would slightly bring up the average experience of that community. And so it is really important that over time, we also remain very closely focused. And what is the experience of people in particular areas and very small localities and neighbourhoods, and not only deal in terms of overall averages. I hope that's answered your question.
Thank you, Jonathan. Councillor Henshaw.
Thank you, Chair. Yeah, it's good to see the report, and it's right that we highlight areas where we are better than the average, and obviously the report indicates that in some areas we are. The areas where we are similar to other areas regarding to the indices is also worthy of note. But also, I think it's right to highlight, and I think we should bring it up, the areas where we are performing worse or are worse than the national average. There are, on page 42, appendix 2, there are 11 indicators showing that it's worsening compared to 9 indicators that are improving. So some things are worsening overall. And, you know, Jonathan, you've touched on some of the things that we, with our partners, can do, the building blocks, as you highlight in the report. But it's been known for many years, and research and information sort of highlights the fact that usually the poorer you are, the worse life expectancy you have, and the worse the area you live in relation to deprivation, then that also has a knock-on effect in relation to your healthy age and your health in old age. And you quite rightly indicate the issue of trying to get people to stop smoking, which is one of the major causes of ill health. And I've read somewhere that we're trying to get teenagers and younger people to actually stop smoking or never to start, and it's indicating now that we've hit a plateau, and they're starting to increase again. So it's something that's got to be ongoing, and we've got to keep on top of forever. So in relation to the report, yeah, we'll agree with the recommendations, but I wonder, Chair, if we could, in relation to the actual recommendations, Jonathan's been quite right, indicating to us that the building blocks, the 1, 2, 3, 4, the building blocks that if we adopt could sort of improve, hopefully improve people's health and living a more healthier life in old age. I wonder if under recommendation 1, where it says note the factors in relation to the building blocks, we could actually highlight the building blocks that Jonathan's outlined in the report as part of our recommendations. Then actually we can go to the recommendation. We talk about the building blocks, which are boom, 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 and then add it to the report, and it gives a little bit more clarity in what we look at in the future. Thanks, Chair.
I certainly don't have a problem with that. Jonathan, are you happy for us to put that in the recommendation so that we keep abreast of those?
Certainly, and that it could be done by making reference to the joint health and wellbeing strategy, where they are set out in terms there.
Thank you for that. Councillor Martin.
Yeah, thanks for the report, Jonathan. Historically, obviously, Ashfield and Mansfield and Bassetlaw have been behind the rest of the county, and the missing building blocks. In what way can we, as a county council, affect their cultural difference? Because that's what it is. It's not that we're performing poorer; it's that the cultural difference in that area must be different to the east of the county. The southeast and the east. So I think it's a cultural thing more than anything. And you're right about the new builds and the building, the housing. It does dilute the figures, but it still doesn't take away the fact that the existing population base are going to still do the same thing. And I think that's where we might need to focus more on. On I know you are doing, and you have been doing, but that cultural thing, when you bring new builds in, that's a new cultural society coming in to dilute the figures, but it doesn't take away from the fact that the existing cultural stuff is still there.
Thank you for your question, Councillor Martin. Based on the evidence, I'm very cautious about attributing to culture things which, in the evidence, one can see that are population level are very strongly shaped by the environments in which we live, grow, and work. So, in answer to your question about what can be done, it is very much about things like supporting school readiness, so that children and young people are ready to get the most out of their schooling. It's continuing to support, as we do, I know, as a council, our schools and our school academies in all of the work that they do. It is working with our district and borough councils, for example, around housing to make sure that housing is safe and secure. It's also about employment and creating the right environments economically for good work in Nottinghamshire to be available to our residents. All of those things feel a step or two removed, don't they, from the things that sometimes you expect me to talk about as a director of public health, but are the things that we have to come back to. I am clear as well that using the public health grant, you will properly expect me to be held to account for making sure that we've got really effective arrangements in place. For example, around the 0 to 19 service, sexual health services, substance misuse services, and so on. Those things are important as well, but rather than focusing on behaviour of individuals or culture, I'll give my emphasis to those other things around the environments in which people live, grow, and work.
Councillor Owen.
Yes, thank you, Chairman. I'm very grateful to the director for producing Grass That Show By Now I Should Be Dead. I found that most illuminating. He talks about the building blocks, and other members have talked about building blocks, but it gives the impression from his comments that the county council or equivalent agencies can put everything right, can provide all the building blocks. And to my mind, there's got to be a much greater emphasis on self-reliance and self-support, because I have to say I do share some of the views of Councillor Martin when he talks about culture and the attitude. School readiness. When I hear head teachers talking about lack of school readiness, it's poor vocabulary. Now, that comes from parents not being prepared to talk to their children or finding the time to talk to the children. That's what it's about, in my view. The inequalities in health also, I suspect, to some extent, are genetically based, and that would be a... I'm sorry, but that is true. If you can have a predisposition to cancer by having certain genes there, so you can snigger and sneer as much as you like, but that is, I think, is the case, and a lot more research needs to be done on that. And I was interested in your comments on smoking and all the work that has been done on smoking over the years, and I remember it well from the days when I was teaching, and you. As a biology teacher myself, it's the health aspect came to me to try and put over, and you would attempt all sorts of various approaches, and at the end of the lesson you'd then go out on duty and go behind the bike sheds to find them all smoking still. Now that's probably a reflection on the effectiveness of my lessons. I don't know. But that's what I mean by self-reliance. So I'm just a little concerned that you're giving the impression that everything we can put right as a county council or as an appropriate authority.
Thank you, Councillor. Jonathan.
Thank you, Councillor, for the opportunity to come back on that. First of all, let me say there weren't any of the lines on the charts where you appeared as an individual. They were averages, and I don't think I've ever heard anyone describe you as average, Councillor. So, in terms of your some of your comments and observations, there's probably two or three things I need to say. It's certainly true that my health and well-being as an individual will be shaped by my genetics. That's true, and I know my family history will bring a certain amount of shaping and conditioning to my life expectancy and so on. What we have a statutory duty to do as a council is to take steps to improve the health and well-being of the population overall. And what we do know from the evidence is that the health and well-being of the population overall is strongly shaped by the environment in which we live, grow and work. Now, that's not to say that there isn't an obvious and clear role for the individual as well. And that's why in the Joint Health and Wellbeing Strategy, one of those four priorities is around making sure that everyone can access the right support to improve their health. So where we have residents who are in a position where they wish to exercise some additional control and influence over their own health and well-being, it is essential that we have the right services in place to support them with that. I'd be much more interested in regard to smoking rather than providing stop smoking services to stop our children and young people from starting smoking in the first place, notwithstanding the loss that would create to the tobacco industry, who rely on children and young people to start in order to feed their profits. In terms of children and young people and speech and language and school readiness, I think there's ample evidence to show from the services we're providing at the moment that where we're able to provide support to parents and households, it dramatically improves the school readiness of children who otherwise would be going to school with just a few dozen words. The input that's provided means that those children are able to go to school with several hundred words and constructing sentences rather than just part sentences. So there's an enormous role for the council in this too. But at the end of it all, I have to agree with your statement. You're quite right, in my opinion. Yes, the county council can't do it all. There are a number of other statutory agencies that also have important roles to play in this, as does government as well. And of course, as individuals, we also carry responsibility ourselves. Thank you.
Councillor Carr.
Thank you, Chair. We are in the situation, of course, that public health was given to us as a statutory function by the government, national government, to be able to influence these things. So that's the situation we're in. That's what we have to do. I accept that with regards to things like cancer and some diseases, yes, it is genetic, but being impoverished is absolutely nothing to do with the genes that you've inherited and everything to do with the life that you've been born into, which is why we're having to do these things. I find page 26, paragraph 10, talking out the building blocks for health and well-being. Well, you know, let's go through these. Every child gets the best start. Very often, as we've pointed out, it's often a lottery as to where you're born and who you're born to. That and it always has been the case. Housing. We've seen the case in Rochdale where people are living in houses full of damp. Now, Broxtowe Council have undertaken already the the survey that Michael Gove has asked us to do by the 19th of December, and we have found 51 houses that have got damp in them, and we're putting that right now. But we can't get into the private rented sector, though the housing stock in that is dreadful in some instances. It really is. Employment. Yeah, there is employment out there, but it's usually low paid, and a lot of people are on in-work benefits. Education, again, can sometimes be a lottery, depending on where you are. Food. We have food banks. People who are working but have to go to food banks. Transport in some areas is non-existent. I was talking to a lady the other day that goes to visit her friend for company, and they share warmth at this time of the year, and she's having to pay £80 a week on taxi fares to get her there because the number 11 and number 12 link bus has been withdrawn. That's not this council's fault, that's the city council that have done that. Air quality, well, I can tell you at the moment, in conditions like this, the emissions is dreadful, and my asthma is really bad at the moment, and I can always tell when emissions are bad. So we've still got that. And community networks, out of all those, they're probably the thing at the moment that are pretty good, because COVID ensured that happened and it's carried on. Now, to a degree, I agree with Councillor Owen. What can this council do to alleviate all the problems we've got in those areas that the government should be doing, are doing in some areas, but clearly aren't in other areas? And I have to say, Councillor Owen, it was like listening to some politician in the late 19th, early 20th century that blamed the working classes for their own impoverishment. I've never heard anything the like of it in this council chamber, but then again, I have in the past. But it's not anybody's fault. If you're born to a low education background, you're likely to be the same. We've got to actually do something about that. And I've tried to be as non-political as possible, but I have to say, health and well-being is probably one of the most political things you can talk about. And I just have to say, I do like coming to meetings like that when Councillor Owen starts off 1-1, because it reminds me why I'm in the party that I'm in and not the one that he's in.
Councillor Carr, can we refrain from mounting personal comments about other members of this committee? This is a non-political committee, and we're not here to criticise other members of any political persuasion. We're here to scrutinise the issues that we've been appointed to scrutinise, not to attack or make comments about personal comments about other members. Councillor Barney, I think you wanted to come back on that one.
Yeah, thank you. I'd just like to thank all the members of this committee for their comments, because I think we are absolutely here for one reason, as paragraph 3 of the recommendation states, to look at ways that this scrutiny committee can better serve the residents of Nottinghamshire with genuine items of scrutiny and challenging particularly the public health grant. I just wanted to say that when you see the slides that Jonathan presented at the outset, and the first time I saw them when I started to take more note in this role, I was astonished by the lack of the gap that exists in Nottinghamshire. You'd think it was a world basis, that kind of 20-year life implication gap, and it's here. It's not. It's in our county, and we take that incredibly seriously. And I actually think I always bang on about not making this political. It's not. It is about how we shape, how we make things better. And so I pick up on the comments you make, Stephen. I agree with you. And I as part of being part of this party, which you said is part of the problem, I'm working towards the solution as well. So I want us to where we can, link arms and do what we can together. And just like the item that went before us this morning, looking at the safeguarding issues, they really, really matter. The fact that Scott is so equipped to do this job is a tragedy. That he's had to go into and uncover some of the most horrific, horrible consequences of the worst elements of society and pull them together. And because of that, he's got the experience to take on this role in a better way. It's a great travesty, but it's how we work together and how we work to bring a better outcome for the residents of Nottinghamshire. And I have to say, Jonathan, in the few months I've got to know you and dealing with us as a committee, I've been very encouraged by the passion that you bring to this subject. and I know that you two are very much open to that scrutiny. So I just want to encourage us all to carry on. Absolutely, let's focus on item agenda 3, and let's not be afraid of the scrutiny to make that gap less in our society.
Thank you, Councillor Barney. Councillor Smith.
Thank you, Chairman. Thank you, Jonathan, for a very comprehensive report. I agree with colleagues that it's good that we highlight where we're doing better than us nationally and where we're the same, and very important that we shine a light on where we're doing worse. Particularly disappointing to see pregnancy crop up more than I thought it would in where we're doing worse. I appreciate that the answer may well be work with NHS colleagues, but what can we do as a council, and what do we do to assist with pregnancy?
So, thank you, Councillor Smith. I'm not sure whether there was a particular one that you had in mind. I have in mind the obesity in early pregnancy, which of course isn't an issue related to pregnancy so much as life course. And so, once again, there are a number of things that we've put in place around that. For example, the Healthy Families programme that the County Council commissions works with young children and with their parents to make sure that they've got the best start in life. As part of that, focusing on making sure that mothers are supported to enable them to breastfeed their newborns, which again contributes to healthy weight later on. There are other things which the 0 to 19s programme is able to do with children with young families to promote healthy weight as well. We also, from the County Council, commission the Integrated Wellbeing Service, which again provides support to people who are wanting to exercise some more control themselves over their levels of physical activity, and with it their weight as well. So all of those are things which go towards supporting people to maintain a healthy weight, which would count towards that particular indicator, as well as coming back to the other theme in terms of working with other partners to make sure that the environments in which people live are also health promoting. So the access that people get to green spaces, which of course the County Council invests in itself, and which districts and boroughs are involved in through their planning arrangements. So there's, again, you're quite right, there is input and partnership work to be done with other agencies on that as well. I hope I've answered your question.
Thank you, Jonathan. Councillor Pringle.
Thanks, Chairman. Thanks, Jonathan. Detailed report as ever. Slightly confused there. Okay. So if we go to the indicators, page 32, bottom, cumulative percentage of the eligible population aged 40 to 74 who receive an NHS health check. Okay, the dates referenced to 17-18 and 21-22. The statement compared to England is that we're better. The trend line shows it crashing as far as I'm concerned. And I could go through this. There's 100 like that, to be quite honest, Jonathan. And some of the worsening cases, in actual fact, are showing a trend line which looks like it's getting better. So it's really confusing me to understand that in the detail. I understand the adjectives and use them as a reference, but I think we could put, and I think we spoke earlier, I think we possibly need to be specific in pulling something out of the report to scrutinise rather than trying to do a full overview. I think that's difficult for us, even though you presented it well. I appreciate that. And again, we're going to ask Councillor Barney and Councillor Carlton direct reference questions to what's the changes that are being made, reference to the adult social care. So help me with this. I don't understand the trend lines compared to the indicators, and I think it's important that we scrutinise rather than debate.
Chair, if you're happy, I'll address that. So yeah, it's a really good question, and let's deal with that specific example to kind of bring it to life. So it is a fact that in terms of these health checks, in Nottinghamshire County, we perform better than other areas of the country. Sadly, it is also the case that everywhere across the country, we find performance in this area has declined over the last several years, not least because of the impact of pandemic, when actually NHS health checks were suspended for a time because GPs either were not able to provide the services full stop or were focused on doing other things. So this is not to, in any sense, mask or pretend that this is something better than it is. Comparing ourselves to England average, we're better than England average, even though our performance on that particular one has been heading down. In terms of the provision of this information, thank you, Councillor. You're quite right. Sharing 200 indicators with committee is no way, I think, to enable you to scrutinise in this particular session. And I was rather hoping that by giving you a bit of a frame of reference and some of the detail here, it was to prompt some thinking about areas that you might wish to scrutinise going forward. I have one or two thoughts on that, but would obviously be entirely guided by committee on that.
Thanks, Chair. Some of these are 8 years out of date now, some of these figures going back to 15 and 16. Are we expecting to be reactive to this type of information as always being out of date, or again, in referencing the challenges that we'll put to Councillor Barney, Councillor Carlton, I'm assuming there'll be something more updated that again will allow us to pick something out of here and scrutinise a little bit more deep if it's up to date.
So, pardon me. So the data that we've got in here is the most up-to-date, nationally benchmarked data. So we've made sure of that. Where there is, you've got a trend line. Clearly, that's going back several years. But the most recent data point is the most up-to-date data. So this is. So what I'm sharing here, it's not a reflection on the fact that we couldn't quite get our act together to get you the latest data. This is it. For something like NHS health checks, if committee decided that that was something that you wanted to scrutinise further, then yes, we could probably bring data about the last complete quarter, for example, in terms of uptake within Nottinghamshire County. We wouldn't be able to benchmark that for you against other areas, but you'd at least be able to see, is it still heading down or is it looking like it's turning around? And we could drill into that a bit, which would enable you to take a look at, for example, well, how are we doing it in terms of uptake in different areas of the county, given the variation in outcomes that we've got in some of our communities? So I'd be pleased if you identified an area like that to come back and furnish you with a fuller picture around a specific area.
Thank you. Councillor Henshaw.
Thank you, Chair. Notwithstanding the issues that we did debating this morning or looking at the report, I mean, because it comes across quite clear to me that a lot of the issues that we're looking at are very complex. And if you're looking at the various indices, the criteria such as income, housing, environment, transport, education, and work, all combined to make it such a complex picture, and we're trying to work our way through it, and we're working our way through it on some information that as Councillor Pringle said, possibly slightly out of date, but we're gaining more information as we go along, and there are various points in here where we can get really up-to-date information in relation to the page, whichever it is, page 50, results healthily people domain, Nottinghamshire, and this it's indicating in this report that the index for healthy people declined, in brackets, got worse each year from 2015 to 2020. So that's quite relevant. It's quite up-to-date information. But obviously we've got an issue there where it's got worse, things have declined. That purely as a result of the pandemic, because I think some of these indicators were on a decline before the pandemic started. The pandemic made them worse, but some of the issues are still quite relevant. So I just wonder, Jonathan, why do you think on that instance, health people's declined and got worse from 2015 to 2020? Thanks, Chair.
So, Chair, so that's something that's been the focus of study nationally, and you're quite right to point out that some of these key indicators were heading in the wrong direction before we ever arrived in pandemic, and there are some indications that this may to an extent be the result of austerity measures as one factor. But as I say, this remains the focus of a lot of attention by the epidemiologists, as well as politicians as well, of course. I wondered, Chair, if I might make a couple of observations. I've intended to share with you some stuff at a fairly high level to talk through building blocks. What are the big things that shapes the health and well-being of the population? I've, as part of that, shared with you the Public Health Outcomes Framework, which of course very properly draws your attention down to specific areas. It might be, Chair, that committee wishes to give an indication of where you might like to focus attention in the future. If I was being asked, there's a couple of things I would suggest. I wonder, Chair, if you're happy for me to share. Okay, so one of the things which we're going to be giving a lot of attention to in the coming months, and which I have mentioned several times in response to questions, is around the recommissioning of the 0 to 19 service. It's the single largest area of spend within the public health grant. It represents one of the things that we provide universally right across the county to every parent of a newborn, a series of 5 developmental checks, and to identify children and households who would benefit from further targeted support. It's enormously important. As it happens, it's something which we perform very well against national average. So, but in recommissioning it might be something which Select Committee wishes to give some further attention to in terms of getting ahead of the curve. So that was one possibility. I note too that a number of the comments have been made with reference to what has the impact of COVID been, and we are undertaking some work at the moment. It's now part complete. We've done a couple of chapters of it, looking at the impact of COVID on particular areas. Now, some of those public health agendas are ones which are very much require a partnership effort. They're not the sole responsibility of the county council, but it might be that some of those are areas which the committee wishes to give further attention to. Or you may well have identified already, for example, around health checks or other areas, things which the county council itself commissions, where you've got some questions, concerns that you might wish to drill into. So that there are 3 suggestions there about where that you might wish to bear in mind in terms of giving focus to further scrutiny.
Thank you for that, Jonathan. Councillor Adair.
Thank you, Chairman. Jonathan, I've got a few issues, and they are something I would like us to come more up to date, because I think we're talking here in the past. We're talking about 15 to 20. Those days have gone. I don't know what lessons we learned in those days, but we should be delivering for the future out of the experiences of those days. Now, there's one thing that does worry me a lot, and we mentioned it, is smoking amongst young people. And I've always been interested in this in public health. And I mean, I remember when 60% of the population smoked, and I think now 20 or 25% of the population smoked. What I'm worried about now, and I see a lot of it, and I get a lot of comments on it, is vaping. There's some idea that vaping is good for your health, or it's not as damaging as smoking. I don't know where that comes from, and I know that people, the health service will sort of say, well, let's get them off smoking through vaping. I'm not too sure that's a good idea, because young people now, you see young people standing outside schools vaping, and I don't know how that can be a good thing for the future. And I don't know how we address it, but I think it needs addressing. And I also, even with smoking, we're in public places we're not supposed to be smoking, people are vaping, and I'm not sure that's good either, because when you inhale that vape that flies past your nose, you're not too comfortable with it. So in that area of health alone, I think there's an address that needs to be developed for the future as to how we manage that, because we'll drift back into the old days of when we used to smoke, and now we're vaping as well as smoking. So I'd like something on that. Now, for me, we were just talking there about, for me, now 20 to 22 is COVID. We've had the COVID, we've had the pandemic, we've had all the issues of the pandemic, and we've had many conversations during 2020 about the pandemic and the issues that it was causing to the local and to the health and to all the other things. What we need, or I would like to know now, where are we post-pandemic? What is the stats now, and where are the building blocks to take us forward statistically from where we've been through 15 to 20, pandemic, and now what is the way forward to get our health and well-being back on board as to the way forward post-pandemic, because I think that's important to the people that I talk to, and they say, well, what's happening now? And I think there's an opportunity here for us to get, I don't know what the stats are, I don't know where it is. Yeah, you'll have to find them somewhere, but I'm sure that they are what actually the situation is on 22, at the end of 22 now. Pandemic was 20, so we've got a couple of years of stats somewhere that we can build and have future building blocks on as to the way forward to the future health and well-being of the county. Families, yes, families are important, and out of families grow families, and I think it's how we measure how we can change that family, because out of families grow families, and what I mean is wherever you start, sometimes that's where you end up. Not always. There's a lot of people actually pick themselves up and do well for themselves. But out of families, in lots of areas, somebody was talking about culture, I would say it's even more families within families that develop the families, and the families that don't in themselves progress themselves into the health and well-being that they could have in the future if there was a different approach to it. Whether that's done through education or whether that's done through other means, I'm not too sure how it's done. But unless we get a grip of that, we will always have the families from the families. I hope you understand what I mean by that, because that's that's what happened. So all your building blocks and all the rest for the future, I would suggest that we actually start now with the stats of where we are post-pandemic, have the building blocks, have a good look at the families and the development of families out of families. And also, I'm really concerned about this idea that smoking and vaping amongst our young people will lead us back to where we were with the smoking. And, you know, yesterday I went in to buy a newspaper in our local paper shop, and I saw an elderly person there who was really in real serious health problems. And what were they doing? And they were coughing and spluttering, they were buying 20 cigarettes. Now, we've got to somehow get a future where that doesn't happen. Thank you, Chairman.
Councillor Adair. Jonathan.
Thank you, Councillor Adair. So I think there are three areas that I need to cover off if I can respond to what you've said. First of all, in terms of the data, the stats, what we have here is the most up to date information around healthy life expectancy and life expectancy. If what you want is further information about uptake and activity within services we commission in Nottinghamshire County, we can provide that, and we be pleased to do that. Information about healthy life expectancy and life expectancy will take longer, and what you've to bring and what you've got here is the most up to date. In terms of so what next? What are the important things to put in place? As you said at the outset, delivery for the future, I think, needs to be crafted out of our experience of the past. Indeed, our evidence from the recent past. And I'm going to risk your patience here, but actually that is about making sure that we've got people who enjoy good work, safe and secure housing, who are growing up in communities where they feel safe and secure. It's about those conditions in which we live, grow and work. The government, I know, in terms of wanting to provide young people in households to have the opportunity for something above and beyond what their parents might have had, I know has put great store in terms of the role of schools and education in terms of driver of social mobility in the future. And that's been a strong emphasis in some of the policy making from government. So bringing this back to what we can do within the county council, that comes back, in my mind, one of the things comes back to school readiness again. And for that reason, the importance of the 0 to 19 service, which the county council commissions using the public health grant, to make sure that young children are fit and ready to take advantage of the school environment that they're going to be in for many years. On smoking more specifically, and to address your question around that, to be clear, e-cigarettes, if we're talking about use of a device which has been sold legally, so in other words, it's a device which has gone through some proper standard setting, that is less harmful than smoking tobacco. So for people who are currently smoking, we would be pleased to promote e-cigarettes as a means of getting off cigarettes. But there is no other group in the population to whom I would promote e-cigarettes, wherever they've been bought. It's not a smart thing to do in terms of one's own health and well-being. And you're quite right to highlight the potential risk that is there. But it does remain the case that e-cigarettes, properly used, are much less harmful than tobacco. And thank you for highlighting smoking again, because as Councillor Doddy reminds us, up to half of that gap in inequalities gap that we talked about at the very start is attributable to smoking. And so it's really essential that we also take additional steps to stop children and young people from starting smoking in the first place. Now, across nationally and in Nottinghamshire, we've got we're on the right trajectory with that. Those numbers have been coming down. We need to make sure that they don't stall and that they continue to go down. One of the things that we're putting in place through Cabinet member now is some additional funding around tobacco control that will help strengthen some of those arrangements, both for adults who are smokers so that they could benefit from an e-cigarette as part of their quit aid, but also in terms of strengthening trading standards arrangements funded by the county council, so that our children and young people are not sold vaping paraphernalia, which potentially is going to be very harmful to their health. So thank you for highlighting the role of tobacco control.
Thank you for that. Councillor Martin, you wanted to come back.
Barney wants to come in.
Oh, Councillor Barney.
It just really quickly. Just in the last couple of weeks, Scott and I were presented some really interesting information about vaping, and it's something I'm also really concerned about. Going back to Councillor Owen's comments about our inability to educate young people and they're not listening. With my own 4 children, I've been astonished at how much they seem to like vaping, and I find it utterly revolting. I can't understand why you'd want anything that smells of waffles and maple syrup floating around. I can't think of anything less sexy. But there you go. But the data was really interesting, and it's actually quite counter to a lot of what I thought was the case. And I think that our forward thinking on this, I mean, it's early days, but I think it'd be good if the committee were also perhaps presented with a similar set of data that Scott and I have had. I think you'd find it really interesting. It has really challenged my views and beliefs on vaping. But I think it's something we need to grapple with together. I think it's something that the county council as a whole need to come up with an understanding of and a way forward with, so that we can step forward in one pace. So I don't know if that's something, Chairman, you'd perhaps like to consider bringing forward as an item for scrutiny going forward. I certainly would appreciate not just being on Scott and my shoulders. I'd like to know what others think about the subject and where we should take it forward.
One comment there. It's now knowledgeable that in schools, high school or 15, 16 plus, vaping is on the increase where it used to be smoking.
Councillor Martin.
Yeah, thank you, Chair. So, just a couple of things, Jonathan, really. Obviously, the government did do one good thing 4 years ago. They introduced statutory education for 16 to 18-year-olds, and that's going to take a while to percolate through. Obviously, local plans being developed by all the councillors across the county are also going to have impact in the future on the statistics that we get. COVID had a great impact on the services that were provided during that period, and that's why some of the statistics are down trending. And obviously we're working a year behind, so we're still working 21, 22 and not 22, 23 on those statistics. That they come from behind. Where I do want to pick up on, and I do think we really do need to scrutinise on this, and I've talked to Dr. Doddy about it before, is health checks, because they aren't a statutory obligation, and we are at the sufferance of primary care who are under stress as it is already, and it's like having an MOT. So you go in for an MOT and it's a job creation scheme, and when the primary care system network is already under stress as it is, it's never going to improve. We've had this ever since I've been on adult health and social care. It's been an issue for years, and I think it ought to become something more statutory, how we do it, how we change it, where people go like the screening program for lung cancer or something like that. And I think that's how health checks ought to be managed, and not at the behest or the ability of primary care to manage it, because it's not working. And I do think we need, some kind of hub-based system where people are booked in and they go when they're 50 or 55 or whatever age it is at the moment, because that system is just not working. And if we were going to scrutinise anything, that would be it. But all it would show you is that in your areas, you've got GP practices that aren't performing as well as others because of their ability, staff levels and demographics, and want to come. People booking an appointment, not turning up. Whereas on a screening programme, I think that would be a much better system in the hospitals or whatever.
Councillor, I think your observations are bang on, and you're quite right. What you're reflecting on from the evidence that you've been given in the past, we struggle with that within Nottinghamshire. It is true that we perform better than England average, but that's not something to be enormously excited about, given the struggles we have too.
Councillor Carr, you wanted to come back on another issue?
It's just to say that I could totally agree that I think one of the primary things we should be looking at is this commission of the 0 to 19, because we've already identified a lot of the building blocks when people are very, very young, starting right from the beginning. And I think that would be a really, really good subject for us to look at. I agree with Councillor Martin about health checks, but as you quite rightly pointed out, it's not a statutory requirement. And whilst Dr. Doddy looks after my wife very well as her GP, and he's got a very, very efficient practice, some practices are under a lot of strain, and you can't get appointments for 10 days to 2 weeks. You can get in the same day very often with Dr. Doddy, but that isn't the case in every GP practice. So we're probably looking at something that we couldn't influence with GPs, but we could influence with actually getting people to be aware of of health checks, which is another matter.
Just to correct any wrong impression that I've given. So to be clear, NHS health checks is something which the county council is mandated to commission, and we do, and actually make provision to put more funding behind this than actually the current level of uptake requires. So we're ready with that. As you point out, Councillor Carr, the biggest challenge is around on the supply side. It's the provision of it, and for reasons which are quite well rehearsed in primary care.
Thank you for that. I'll make an observation about health checks, because I think they used to be called well man checks and well women checks in the past. And I won't bore you with how old I am, but I went for a medical issue, and when I attended the GPs at the age of 67, they asked me what my blood pressure was. I said, well, I've no idea. You've got my records. And she looked at my records. She said, you've never been for a well man check. I said, no, nobody's ever asked me to come for a well man check. So it's not just happened because of COVID. It's been going on for many years. I won't tell you how many, but but it has been going on for many years, and it's an issue that if we're commissioning it, then it's probably something that this committee should be looking at, scrutinising, and finding out why GPs are not delivering something that we're prepared to put funding into. Are we content? We've had enough debate on that. We want to run through the recommendations. The recommendations that are in the report, obviously, we've agreed to modify the first one, and then we're looking at the issues that we've discussed about what we want to look at in greater depth in the future. And I think there's broad agreement about the 0 to 19 service, and that's a service that we're looking at recommissioning anyway. So it might be useful for this committee to get involved early on in the process rather than wait till it's completed and then we find that we could have had some input into it. So if that's acceptable to Councillor Kerry, sorry.
Yeah, sorry, thank you for letting me in, Chairman. It's just that on recommendation 2 says, note the areas of work required to address the minority of outcomes we're not sure is worse than the England average, largely identified, etc., etc. I remember something in my past in education, as a governor of a school, where the big thing was trying to get the disadvantaged and lower performing students to get better and add value and whatever. One of the worst outcomes that I remember was that part of that process is where you have successful children, and certain these areas now we are successful or better than the England average in some of the things that we're doing. Is what happened was I said, look, we cannot forget that the higher achievers, they can also add value. And what happened was that ultimately this came in an officer inspection where the school was not given a good outcome because of that very point. So my point is that in that, yes, there is work required to address the minority of outcomes, but actually we should continue the good work where we are performing well, because it's the combination of all those things that gives the best outcome.
Thank you, Councillor Kerry. So we're in agreement about 0 to 19, which obviously is recommendation 3, is where we consider the impact. And I think we've discussed the the health check issue, which is something that we commission, and perhaps that is something that we need to look at in deeper depth in this committee. And I think the other thing was the question about COVID stats and where we are on COVID now. Speaking from experience, my mother's in a nursing home, and I just had a phone call when I was in the meeting this morning, and when the nursing home name flashed up, I thought, oh, what, something happened to my mother. What it is, they've had another COVID outbreak. So it hasn't gone away. And I think this winter we're probably going to see further strain on resources throughout our partners in terms of COVID. So it might be useful for us to update our knowledge and view of the statistics that are happening lately. I know that the local hospitals are seeing a bit of a spike in recent weeks on COVID. So it may be something that perhaps, Jonathan, we could get statistics on that are more up to date before we have our next session. And the final one that I've got on my list was the issue around smoking and vaping. I mean, that's always been an issue that's concerned me. I gave up smoking in 1976, which is a long time ago. But we never had vaping. I never chewed chewing gum, and I never chewed nicotine sweets. But my brother, who's only slightly younger than me, gave up smoking much later, and he's vaping most of the time. It's like a chimney when you go past his car. It pullers out of his window. And my concern is that, as Councillor Adair said, and being chair of a multi-academy trust, is that the number of children in our academies that are actually smoking, or not smoking, but vaping outside the school gates. And obviously we can't do anything about that when they're outside the school gates. If they vape in school, the paraphernalia will get confiscated. But that is an issue, and I think that's something that we may wish to look at as well. So are members content with those recommendations going under? I think we add those to the third recommendation.
Chair, before we wind up, and Martin might, when he does his précis of what we decided, I mean, I did mention if we could include the building blocks in recommendation 1. I wonder if that is.
I've already mentioned that. We have agreed that. Yeah.
Thank you.
Are we all content then? Thank you, Martin. If you just.
So, like I said, it's a little bit complicated, and these will get written out nicer at the time. So with the first recommendation, we will note that they are as referred to in the joint health and wellbeing strategy, to make that more specific and more trackable. The second one is as read, and then there's the chair summarised. So the areas of work that we'll look at, and obviously there'll be work with the chair, vice chair, and officers about this. So the work is like recommissioning of the 0 to 19 service, impact of COVID on public health, the health check service, and also the issue of tobacco control and vaping, and obviously the figures that Councillor Barney talked about. So we'll look at how we'll get those scheduled over the next few months or so, and how we'll look at it, because it may not be everything in committee. There may be some reviews outside of the committee, so there'll be discussions about that as well.
Members content? Councillor Kerry. All right. Are we all content with those recommendations? That's unanimous. So we move on then to agenda item 6, which is the response to the committee on the sustainability funding for external adult social care providers. Yes. Noted. Councillor Barney, are you presenting this one?
Yes, Chairman. Just before I do, I wonder if your quitting smoking in 1976 also triggered the end of the famous heat wave. It was the year I was born to make you feel. Let's move on. So yeah, just quickly on this. So I think members are very aware that this £500,000 funding was made available back in June, and this committee requested that there be an update on that spend profile, and also on how it was being put forward and marketed to providers, to make sure that the money is fully taken up. And so Cash has kindly pulled together this report, which I'm sure you've all read, which goes some way to trying to explain where we're at. Just to say, I don't think that this is an item that's really up for considerable debate. I'm happy to take questions. And I think that there's further review work being undertaken, which we will be reporting back on as a part of the full market review in the new year. So over to members.
Thank you, Councillor Barney. I think it's been made clear to us as well that there isn't a shut-off date at the end of this financial year. That money is available to go beyond the current financial year if necessary. It is a ring-fenced pot of money. Any observations or questions, anyone? Are we content with the response? Thank you. All in favour? That's clearly carried and noted. Thank you, Councillor Barney. The final item is work programme. Martin will take us a run through this, but the issues that we raised in the public health, they may result us in having some subcommittee, well, not subcommittee, but working groups to look at them in greater depth. So they will need to be added to the programme and membership agreed at a future date. Councillor Adair.
What's that?
Page.
What page is that? Sorry. Oh yeah, that's what we've done. Yeah, so just give an update on that. Yeah, we had the meeting on that back, I think, on the 21st of November. All members were invited to that, and I think 6 members of the committee came, where the strategy was presented to the members, discussed it and made a recommendation. The report's actually been delayed slightly. It's not actually going to Cabinet now till January, but the findings from that review will be appended to the Cabinet report.
Thank you for raising that.
So obviously we've got the work programme, so the next meeting is the 13th of March. As you can see, we've only got one item scheduled for that, but I'm sure some of the stuff that's come out from the public health item will be considered at that meeting for any item that we think it can be dealt with in committee. Just a reminder, I know we've got a meeting on the 12th of June, we've got 2 items for that. And then obviously the project group work as well. So just a reminder, if there is anything else that you would like to bring to the consideration of the committee, just let myself and the chair know, and then we can have the discussion with the chair of overview. And also a reminder to keep looking at the forward plan every time it comes out to see if there's anything on there that you would like to consider for like pre-decision scrutiny. And obviously it comes out monthly, so again, just let us know if there's anything you see on there.
Has anybody got any burning issues that they want to see adding to the forward plan at the moment, apart from those issues we've discussed today? No. Well, yeah. Tell me, I'm acclimatised to it. I've had no heating for a week at home. So it's quite warm in here, actually. Right. I think that concludes the meeting, members, and thank you very much for your attendance and patience.